This video is on shoulder impingement. So there are a couple different kinds of shoulder impingement. Today we're going to be talking about anterior shoulder impingement, and that just means the front of the shoulder. A lot of different reasons why somebody could have that or be diagnosed with it. Today we're just going to talk about just how it can happen and strategies and ways to maybe improve that. And this will be a series, so we'll later in some other videos we'll also talk about how do we address it, how do we fix the problem. But today we're just going to be talking about what it is. So shoulder impingement is where the anterior structures of the shoulder create a pinching or a decreased space into that area of the shoulder region. Some people call it subacromial impingement. That just means where that bone is there, that space gets narrowed down. Now, when that space gets narrowed, that can create a lot of pain and obviously limitation with overhead motion. So in volleyball, like specifically, Sarah's a volleyball player, so she's going up to hit a ball or spike a ball or block it. She may not have the range of motion necessary to do those movements because that space has been narrowed down and shortened. Now, when we look at it from an isolated standpoint, we can look at the pecs, which are muscles in the front that attach into the shoulder. Also the bicep, which is muscles that attach from the elbow into the shoulder. Those can be kind of shortened and become tight, which create the shoulder kind of become rounded. And nowadays, a lot of students and student athletes and professionals are sitting on a computer all day long, right, Sarah? And then they get that forward head posture, and their shoulders are rounded and internally rotated, and their spine gets kind of kyphotic, just meaning rounded forward. But also those hips get tight. So when we look at shoulder impingement, we don't always want to just look at it on a microscope, isolated just to the shoulder. We must address the whole organism, the whole person, the whole athlete to really get successful results when we're treating that. So when we're looking at it locally, those structures can be kind of shortened, which creates a decreased space. The thoracic spine gets rounded, which creates more of that shoulder rounding forward. Great posture. And then now tighten your hips. So roll your hips forward this way, hunch over. There you go. So now her hips are tight, her shoulders are tight, and you can tell from this angle, if she were to raise her arm, so stay hunched over, that she just doesn't get the range that she needs. And we would call that shoulder impingement because those structures are getting pinched on. But if we correct her posture and get her up nice and tall, and then all of a sudden she's got more clearance and that there's no more of that kind of pinching down on those structures. So instead of just thinking about doing nothing for it or using rest as a treatment approach, or ice is very commonly used, we must kind of get to the root cause and fix those mechanical problems in order to actually get long-term results. So in the later series, we'll talk about how do we attack, stretching out some of those structures. How do we neuromuscularly train our body when we're up high to have the right strength so that when we're hitting that ball or spiking that ball, that all those parts are working together and you're not getting that shoulder to wear down. So enjoy this video and share it with somebody that may need that. And definitely stay posted for the other subsequent videos after this one on how to fix the problem.